Hi, we are going to do dental misconceptions with Dr. Amaning. So I'm going to ask him some questions and he's going to give us his reaction and thoughts. A patient comes in for a consultation and states that I'm going to wait, I'm not in pain.
You don't ever want to wait till you're in pain to get dental treatment done. It costs more, and sometimes you stay in pain longer as a result. By the time you're in pain, whatever the problem is becomes significantly worse and sometimes requires a lot more intervention. I always recommend you treat it when you're not in pain. It's usually faster, easier, and you may never get in pain. But if you wait too long, it gets significantly worse.
I'm 70 years old and I state I'm too old for implants.
70 years old is not too late for dental implants. Preserving your quality of life and your ability to eat proper and healthy foods are very important, especially at that age. Being able to maintain adequate nutrition through foods like fruits and vegetables is very important. So even at 70 years old, the 3 to 6 months it will take for you to improve your quality of life is well worth it up into your golden age.
I'm a patient that comes in and says, I'm nervous about going to the dentist. I'm scared I will be judged.
There's nothing to worry about. This is why we're here. We're here to help you overcome your fears and help you improve your confidence. Whatever you may present to us, we've probably seen significantly worse. In fact, I know that I've seen worse. And I love that transformation, being able to go from where you are to where you want to be. So judgment is never on the table. The main important part in all this is how willing you are to move forward to a better oral health.
Are bad teeth genetic?
Bad teeth can be genetic, yes. The amount of calcium, their predisposition to decay and gum disease, they all can be genetic. But it can actually be passed on a lot easier than you think. Parents kissing babies can pass on bacteria. It's a combination of habits and genetics. Genetics alone do not typically lead to tooth loss, but habits alone may not necessarily lead to tooth loss either. So it's a combination of the two. You could be built like Michael Jordan, but you never lift a single weight. It won't help with heart disease when you're 60. Same thing with your teeth. If you don't maintain them, it doesn't matter how great your genetics are, it will still succumb to bacteria and decay and tooth loss.
How often are you supposed to come in for maintenance?
Twice a year is recommended. Obviously, maintaining it in between is very important yourself, but twice a year so we can catch things before they get worse.
Well then.
All right.